And now it's time to pass over to our moderator for the next session, which is a double deep dive into health tech. Maddy Phipps-Taylor is CEO of Eva Healthcare Technologies. Over to you, Maddy.
Thank you, Mark, and welcome to this next panel, which is a fantastic opportunity to deep dive into health tech. Obviously, one of the areas that has had a lot of scrutiny and a lot of pressure applied to it over the last 6 months, but fantastic to see the progress that has been made in that period. I'm very delighted to have a range of people on the panel with us today. We've got two halves to the panel. The first half, we have Minister Jens Spahn with us, as well as Rachel Murphy and Frederick Defoe. We're hoping to still have Matt Hancock. He is still trying to get through into the session, hopefully. However, we will just continue without him if he doesn't join us. The second half of the session, we're going to be being joined by two more panelists, and we'll have a slightly different focus, which I'll introduce at that time. So to kick us off with this first session of the panel, we're talking about what the experience of health tech and how that has helped with the pandemic so far, and across different spectrums, so both the government and obviously in the response from the technology sector. I'd like to start with a question, I suppose, to Minister Jens Spahn, who is the Federal Minister of Health in Germany, as to his experience of technology in COVID and how that is he is embracing it to help tackle the unique and challenging circumstances we're in at the moment. Over to you, Minister Spahn.
Thank you, Maddy, and thank you for having me in this conference. Actually, first of all, this corona pandemic has made very clear, or has been triggering actually areas, issues, problems that already have been there, perhaps for decades, but not yet been solved, and became very obvious again then in this crisis. And one area definitely is the digitalization of the health system in general, and the German one in particular. I would say faxes are still the most used way of communication in our health system, at least when it comes to communicating between the different players within an hospital. It might be very much digitalized, but as soon as you want to communicate with another hospital or another player in the healthcare system, it's very much like the 90s and not like 2020. So in this crisis, we were very much focusing at several areas, different areas where we wanted to speed up the digital experience, and especially we needed in some areas. One, for example, I will give 3 or 4 examples. One is the ICU capacities and the free flow of data. At the very beginning of this pandemic, we saw that in this by the way, very special German situation of 16 federal states, 2,000 hospitals, and one national health minister, no one had really an overview how much ICU beds are empty, or how many are there anyway in general, and how we can actually be better steering these capacities. And what we have developed is a digital ICU registry that gives an overview daily for me and the other on a federal state level, other health ministers in Germany, what is actually the current state of play, how many beds are occupied, with what kind of, how many COVID-19 patients are there, and how many beds are empty. So actually what has been discussed for years, if not longer, was now possible within some weeks, that we finally got the interfaces working. I forced by a law hospitals that they need to deliver the data that is needed. And so regarding ICU capacities, we have shown that you can make a difference just by bringing different data together and then giving an overview where we are. Second area is, of course, the Corona warning app, and this kind of app that every nation actually and many players try to develop with many challenges to be regarded. Actually, one in Germany is always data protection, and the special approach at least Germans have to data protection issues. So we had to find and develop a Corona warning app that actually is not really collecting anywhere some data on the central server, but very much steered on the device and collects the data on the device. By the way, there's much of German technology development in it regarding Bluetooth. Because of course we were very much relying on Apple and Google, but when it comes to the Bluetooth technology in it and the ability to really measure for how long, which distance you had with someone, that was developed here in Germany, and I'm very sure you will see this kind of technologies in many, many different new apps just far away from the corona pandemic, but still it will remain. With over 18 million downloads so far, 18.7 it's today. Now we have already recognized the positive impact of the technology, and especially now when the numbers are increasing, we day by day can see makes a difference. Which brings me to the third area, because the app is connected with the labs. And more than 1 million results of the labs, positive results have already, and not just positive and negative results have already been given to the citizens, the patients directly. Of course, it goes to the public authorities as well, but immediately on the app, they get the information too, and that is when at least several hours to be informed earlier. But the labs for that had to be interconnected too. Until some weeks ago, labs in Germany actually informed the public health authorities, the local public health authorities, by fax, really by fax, as I say it, about a positive infection. And now what has not been possible to change for really 20 years or something, this is a long debate, but because of many vetoing players on different federal fields, it was not possible to really develop a national system of exchanging that data, especially positive results, not just on corona, HIV, whatever. We have several diseases, infectious diseases, where we have the obligation to send the results to public authorities. But now, within 3 months, we were able to change what was not changeable for decades. So labs now, online digital, can inform the public authorities and others like the Corona Warn app, and that really made a difference. So there are 3 technology differences we could make in the past months already. We are working, for example, that was just a meeting I had before this, an internal one, for example, when it comes to vaccination surveillance and monitoring on other tools, digital tools, some standalone tools, because it really needs to be quick now. Of course, in a perfect world, you would develop something very complex now, including everything. We will do several different standalone digital tools for surveillance, for pharmacovigilance, and for just informing the patient that he has a second appointment to go to for the second shot of it. So actually, that's another area where we will make a difference now with technology. And what I really advocate for here in Germany is that by this pandemic situation, we can see how much digitalization can make a positive difference and helps us to better help the people, actually, and to better get through this pandemic situation. And that is actually what I hope we all learn for the future, that digital is not just something very abstract in health, it is very concrete and can make a difference.
Thank you very much for that, and it's fantastic that we will draw out some examples across the boundary countries that have different approaches, but with the same outcome and intent in mind. I wanted to welcome to the panel Minister Matt Hancock, and it would be great to hear from you in a few minutes, so 2-3 minutes of your experience. Obviously, this has been an incredible journey for you, probably personally, as you've seen in the last 6 months, technology being used as a force for good in the health sector. Can you give us some of your personal experience and maybe some examples of the things that you're most proud of?
Well, I just want to I want to pick up where Jens left off, because I think the biggest thing that's changed during the pandemic with respect to this agenda of medtech is that both the public and the clinicians are now demanding and drawing through technology rather than essentially having or deemed to have a skepticism about it. So people like me who are big tech fans, there has been a growing band of early adopters in the NHS and in the UK health system. And thankfully, the early adopters were just enough, and the underpinning technology was just strong enough so that at the moment the pandemic hit and the mass market moved from being essentially neutral on health tech to essentially embracing it, we had the underpinning structures ready, and now there's just the in a classic S-curve of adoption, we now have the vast majority are enthusiastic users of telemedicine and of technology. Just a couple of examples, and I'm really struck when we have our international calls with Jens and others. We all have seen a very similar radical increase in the use of telemedicine in primary care and in outpatients. In the UK, 99% of GP practices now offer video consultations. That is up from under 10% before the pandemic. It's a radical shift. We're also changing the financial underpinnings of the NHS to ensure that in primary care that GPs are proper. Those consultations need to be properly counted and accounted for. We've seen the extensive use of 111 online to access care, whether that's secondary care, urgent, but secondary care that doesn't require a 999 call, but is urgent. And that itself allows the NHS to triage patients to where they best can get the treatment. And that is a huge amount of that is done now online. And then as in Germany, we've been working with Germany, in fact, on the app, which we launched on Thursday. And I'm really glad to say that as of noon yesterday, which is the latest figures I've got, we had 12.4 million downloads in the first 3 days. And it's the fastest downloaded app in British history. So we're pretty proud of that. And it's already exceeded 20% of the population who could download it, and the downloads are still going fast. So there's a huge amount of opportunity in this space, and there's a huge amount of exciting options. The critical thing that's changed is that it's now being demanded by the system rather than evangelists trying to drive it into the system.
Thank you. And I've sensed that change myself as well. I have downloaded the app. If anyone online who is in the UK and hasn't already downloaded the app, then they should do so. But that change of actually, you're saying from the S-curve, from being at the bottom of it to really we're on that steep incline where most people are adopting it, and they have the tools, for example, a smartphone, to be able to embrace it. That really opens up a lot of opportunity in the future when you know that people have an app in their hands where you can have that direct engagement with them. I'd like to bring in next Rachel Murphy, who's the CEO of Difrent, and as part of one of the providers who are taking those problems and delivering them through technology on behalf of the NHS and the public sector. Rachel, what's your perspective on the last 6 months particularly, and what's really been embedded and is fantastic and it's good to see, and what's still yet to do you think?
Brilliant. Thanks, Maddy. So I'm Rachel, CEO at Difrent. It's a real privilege being here alongside ministers and health experts across Europe. My background is probably 15 years across health and social care. And I previously ran the patient-facing transformation for the NHS for a couple of years. And then 3 years ago, I stepped out of the NHS to build Difrent. And my kind of motivation around that was to create a company that truly understood the NHS and delivery, and we have, deep domain knowledge of health and social care. And I think the bit for me with COVID-19 that has really kind of shifted the conversation between health and tech over the last 9 months, I think we've seen technology play a pivotal role, helped by government policy and the establishment of organisations like Government Digital Service, and kind of by bringing digital by default services to the forefront. And I think, suddenly it became riskier to do nothing than it was to embrace digital and technology. And in a lot of ways, we leapfrogged many years in the last 9 months. And I think that really demonstrates not just a willingness, but also a capability. And from a personal standpoint, I'm very proud to see so many innovative SMEs engaged alongside larger organisations to really help the NHS rise to the challenge. I think crowdsourcing has also played a really key part in how we as a country are responding to COVID-19. And a great example of that is the Zoe app, which has been, asking citizens to log how they've been feeling for the last 9 months. And by definition, that has created a huge repository of data and of insights. And as Minister Hancock referred to, in way of virtual consultations, that was a huge challenge when I was working in the NHS, trying to drive that adoption. And almost overnight, that has happened. And I think for me as CEO of an SME in the health tech space, we're really leveraging our capability to support national and international efforts. And I think at the minute, it's really the time for cooperation, collaboration, and kind of co-production.
Thank you, Rachel. That's excellent. And part of that co-production element, we're going to come back to that as part of our questions as well. So lastly, I'd like to bring in Frederick Defoe, who's the Deputy CEO of Poste. And from the sort of smaller end of the market, perhaps represented by Rachel here, you're a very large organisation delivering very large installations of technology and engagement with the public about their records and how to access their health providers. What has been your experience as a company delivering, stepping up to the mark when it's come to the last 6 months of COVID?
Yeah, okay. Good morning. Poste is a French subsidiary of the Groupe La Poste. Maybe it's not known. We are affiliated to the digital branch of Groupe La Poste, and we position ourselves as a third party digital trusted partner for government and private company. Our experience during this crisis has been twofold. We have brought technology to help the government and the population during this coronavirus outbreak, 2 ways. Just two very pragmatic examples. The first one is an application called Maddy Coronavirus, which is a French website to guide people showing symptoms or signs of the disease and guide them towards the right people, emergency, hospital, or doctors. The result of that is that today it's one of the most used applications in France regarding coronavirus, because we have more than 1,000 million of people who have connected on the website. And the result of that is that we have divided by 8 the inflow to the emergency, because people were well oriented towards the right organization, emergency, hospital, or doctors. And today, thanks to this database, which is of course a secure database, we are able to foresee the impact of pre-symptoms with a time frame of 14 days in advance, which helps the government to monitor the crisis and allocate the right place. This was the first example I wanted to speak about. Application is an application called COVIDom, which has been developed with the APHP, the Parisian organization, which is one of the biggest in Europe, which is a telehealthcare application enabling people to be monitored and to decongest the hospital installation by putting in place telemedicine and telehealthcare. Covidom is based on a software which is coming from a startup, Nuvial, which is has been partly acquired by the group La Poste recently.
Excellent. Thank you. Thank you very much, Frederic. And Rachel and Frederick, you're going to be staying with us for the next panel. So I'm going to just ask a few questions of our ministers while we still have them. Minister Spahn, I wanted to ask about your views on how technology in the healthcare space will help us build a more resilient system, both for winter and potentially a wave 2 of COVID or any other health crisis. How do we use what we've learned to make a more resilient system going forward?
Well, actually, it's when it comes to technology, it's what Matt said and what I already said earlier is actually that we take this lesson that it is. That it is just taken, given that digitalization in healthcare makes a positive difference for, not just for patients, by the way, it makes it much easier for doctors and all the others engaged healthcare workers in the health system too. We want to start a new electronic or digital patient record on the 1st of January next year. That was anyway, but we were very unsure how the acceptance would be. And what I'm very sure of is that after this experience and this crisis, there will be a much higher acceptance, not just among citizens, but among doctors, because the biggest veto player in the past, in many areas, were the doctors themselves. So what really remains regarding technology in the health system is this acceptance of it, that it makes a positive difference. And the second thing that will remain for sure in the 20s is this testing all over. I'm not talking about COVID-19 or corona testing, I mean testing in general. The devices, and there are already some, and it will be more and more, the devices that you connect to your mobile, you take blood, urine, whatever, liquid you get out of your body, and it will tell you something about your health status daily or twice a day if you want to. And that, of course, changes the whole way the health system works. And actually, that the doctors know more about you than you yourself might know. And that would have been there anyway, and it will be there anyway, but this pandemic situation with the realization that testing and even daily testing might help to protect you and others, that will remain too. And so the acceptance of daily testing might be different too, and shape the 20s more than one might think today. That is at least what I assume.
Thank you. And Minister Hancock, I mean, to your point, both on the resilience, I suppose, going forward, but that view on the acceptance within the health and care professional groups of this sort of technology. What would be your view on that?
Well, people who were skeptics have tried it and found that technology helps them improve the way they can deliver care and helps patients to access care more easily. And so, so that's why COVID has changed the culture from techno-skepticism to techno-enthusiasm within the NHS and within almost all advanced health systems across the world. I think just building on Jens's comments, which I entirely agree with, there is a broader change that will happen too, which is that the more that you can put somebody's health into their hands through a smartphone, the more that people will feel ownership of what they need to do in order to stay healthy. And so the prevention of ill health agenda will be enormously enhanced by people having the tools in their hand to be able better to manage their own health. And I've been struck by this, the enormous focus that we've rightly had to put into diagnostics over the last 9 months. Jens is very lucky. He started with a brilliant diagnostics industry. We started with a very small one, and we've both built them at record levels for our citizens. And we've learned an awful lot from how Germany does it. But the striking thing is that the focus of the debate on that has almost entirely been about COVID tests, understandably. But actually switching the whole system to be more diagnostic and therefore more about preventing ill health is a long-term change that we need to go on, and we need to accelerate that path. And I've absolutely no doubt that will be one of the long-term consequences of COVID, and it makes the system more resilient.
Thank you. And we're coming to the end of this session, the first half of this session. I just wanted to bring in Rachel and Frederic for sort of a thought or a question that you have for the ministers at this point before they hop off for the next stage of the panel. So either one of you want to raise a question for the ministers? Rachel.
Yeah, I will do. Thanks, Maddy. So I guess probably a question to both ministers, but one of the overriding challenges whilst I was working within the NHS was around interoperability, and that was a real challenge 9 months ago. And I think a number of the point solutions that we've had to build to respond to COVID-19 are likely to add to that. Do you have any on how we tackle that?
Oh my goodness. Well, how is a huge question. All I'd say is I never thought when I became health secretary that walking into a group of nurses in a hospital, the most exciting thing you could say is that we're going to sort your interoperability. But that's true, and it's a huge journey. But at least it's one on which now everybody has agreed that we must travel.
Thank you.
And if I just can add, we actually force by law though that there are interfaces and standards that will be set by us, a regulatory framework, and that all those who develop software and information systems for hospitals or general practitioners or whomever, pharmacies, they have to adapt to the standards, otherwise they can't be on the German market. So actually we will enforce it by law that you have to have a software that is able to connect with others.
Excellent. Thank you very much. We've run out of time for the first half of our panel, but I just wanted to extend my huge thanks to both of you, Minister Spahn and Minister Hancock, for joining us today. It's a great, when you're so busy and you've got so many other pressures on your time, to share your experience with us. So thank you very much. We are just going to